Hi guys, in this video we'll discuss about the differentiating feature of left heart failure and right heart failure. Uh, it is most of the time we get confused what are the pathophysiology and the symptoms of left and right heart failure. So before understanding the pathophysiology and the symptoms of the right and left heart failure, we have to understand the anatomy of the heart. In this picture, you can easily make out the anatomy of the heart. You can see this is the right side of the heart, this is the left side of the heart, and through the superior vena cava, the deoxygenated blood. One second, just let me change the color of my pen. Okay. So through the superior vena cava, this is superior vena cava, this is inferior vena cava. To the superior vena cava and inferior vena cava, the deoxygenated blood of the body, it will comes to the right atrium, and through the, this is a representation of body. So through the superior vena cava and inferior vena cava, blood from the body, the deoxygenated blood, poorly oxygenated blood, it comes through the right atrium, and through the tricuspid valve, the deoxygenated blood goes to the right ventricle, and through the pulmonary valve, through the pulmonary artery, the deoxygenated blood goes to the lungs. This is two lungs, so the deoxygenated blood goes to the lungs, and after the oxygenation takes place, the oxygenated blood, one second, let me change the color of my pen. So after the oxygenation process by the lungs, the oxygenated blood from the lungs, it comes to the left atrium through the pulmonary vein, and through the mitral valve, the oxygenated blood goes to the left ventricle. And when the contraction is there, left ventricle contraction, the blood from the left ventricle, it will go to the body, to the aorta, and oxygenation of the different parts of the body will happen. So this is the anatomy and physiology of the heart in normal condition. So heart failure means, what is the meaning of heart failure? Heart failure means the failure to contraction. The failure of contraction is the heart failure. So the failure of right heart failure means the failure or less contraction of the right ventricle, right side of the heart, and the left heart failure means the less contraction or failure of contraction of ventricle, left ventricle. So if the contraction is not proper, what will happen? This is the pathophysiology of the heart failure, and the symptoms of it you can easily understand from the pathophysiology. Let's discuss the pathophysiology of heart failures. So if there is not enough contraction of right ventricle, what will happen? The blood will not go to the lungs. So what will happen? There will be backflow of the blood because there is not enough contraction. Blood will congest in the right ventricle, right atrium, so there will be backflow of the blood, and this backflow will cause the systemic overload, systemic congestion or systemic circulation congestion. So the backflow of the blood and the less contraction of the right ventricle, failure of the blood to go to the lungs, it will cause the systemic circulation congested. It will lead the jugular venous pressure, increased JVP, jugular venous pressure, peripheral edema due to the congestion of systemic circulation, peripheral edema. Then there will be ascites. There will be ascites. There will be congestive hepatomegaly, congestive splenomegaly, weight gain, nocturia, and positive hepatojugular reflex. So all the features are related to the congestion of the systemic circulation. Congestive hepatomegaly, congestive splenomegaly, fluid overload that will cause weight gain, ascites, peripheral edema. So these all are the features of the left heart failure. Now we will discuss the left heart failure. So in case of left heart failure, there is less contraction or failure of contraction of the ventricle, left ventricle. So this will cause failure of flow of oxygenated blood to the body. So this will hamper the flow of oxygenated blood to the body through the aorta. So what will cause? This is oxygenated blood. So failure of its flow properly, it will cause fatigue. Left heart failure, fatigue of the body or excessive tiredness. Second, the failure of contraction of left ventricle will cause the backflow of blood into the lungs. So there will be pulmonary congestion. And all the symptoms are the result of this pulmonary congestion. So what are the symptoms of left heart failure? The predominant symptoms are related to the passive congestion of lungs and pulmonary edema. It will cause coughing with pink frothy sputum, dyspnea, that means breathing problem, orthopnea, paroxysmal nocturnal dyspnea, breathing problem in night, in sleeping, crackles. The pulmonary capillary wedge pressure will elevated. So these all are the features of the congestion of the lungs because of the less contraction or failure of contraction of the left ventricle and the less oxygenated blood flow in the body. Hope you are clear about the anatomy and pathophysiology and the symptoms of the left and right heart failure. So in brief, in right heart failure, there will be circulation congestion or circulatory congestion. It will cause edema, peripheral edema, ascites, congestive hepatomegaly, congestive splenomegaly, increased jugular venous pressure, and in case of left heart failure, there will be congestion in the lungs. It will cause the dyspnea, orthopnea, coughing, nocturnal dyspnea, paroxysmal nocturnal dyspnea, crackles, etc. So in this video, I think this is very helpful video for who confused about these two heart failures. Thank you very much for patient listens. We'll meet in the next video. Thank you very much.